I am Dr. Mudit Khanna, Consultant Orthopedic Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. I have special interest and expertise at treating osteoarthritis around the knee joint. Today, we will be talking about what is the difference between a partial knee replacement and a total knee replacement. A number of patients come to us wanting to understand whether they are a candidate for a partial knee replacement or not, but most of them don't know what a partial knee replacement typically means. So let's understand the difference between a partial knee replacement and a total knee replacement. The knee joint is made of 3 compartments, and if you look at a knee joint, it is made of 3 compartments, and if you look at these 3 compartments, we have an inner compartment or the medial compartment of the knee joint, an outer compartment or a lateral compartment of the knee joint, and a third compartment which is essentially behind the kneecap here, known as the patellofemoral compartment. Now, when somebody has arthritis that is limited only and only to one compartment, not early arthritis, bad arthritis, but bad arthritis limited to only one compartment of the knee, then that patient is traditionally a candidate for a partial knee replacement surgery, where you can resurface only the single damaged compartment. Now, there are several preconditions that need to be fulfilled for a patient to be a candidate for such a procedure, but the major one amongst them is that the involved compartment should be only one and the ligaments around the knee should be intact. Now, in a partial knee replacement, what you will see when the procedure is done is that the whole distal part of the femur is not resurfaced, only a small cap is put on the involved compartment and a small tray is put in the involved compartment on the lower bone, and we leave everything else the way it is. The ligaments stay like they were before. We don't damage or we don't remove any of the ligaments of the knee. In contrast, when it comes to a total knee replacement, what is done is that the entire surface, the entire 2 compartments of the knee are resurfaced and a cap is put at the end of the bone completely. Also, the compartment, the third compartment, which is essentially the compartment behind the kneecap, a small patellar button is put on the back side here. So, this essentially is the difference between a partial and a total knee replacement. The advantages of a partial knee replacement are that less bone is removed when we compare it to a total knee replacement. It is also said that the patients get a knee which feels a little more natural, like the natural knee they had before. The amount of surgical time is relatively less, the blood loss is less, the size of the incision is less, the range of function or the range of motion of the knee is better, and patients are able to return to a more active lifestyle relatively faster. However, I must emphasize that every patient is not a candidate for a partial knee replacement, but if you are a candidate for a partial knee replacement, then a partial knee replacement may be a better option than a total knee replacement for you. We have been doing partial knee replacements for many years now at Wockhardt Hospital. So if you think you might be a candidate for a partial knee replacement, please come and see us at our clinics at Wockhardt Hospital. Thank you very much.